I'm a retired Air Force pilot and working for Southwest Airlines and been there 18 years. I always loved flying. Just being active, being able to do things, move around, work, ride a bike, being with the family, that's the most important thing, being with the family and being able to do whatever they do without holding them back.
Guy's a very active man. He likes to ski, he likes to walk and run and jog and work out, and all of those things were very limited.
I did a lot of research looked around, and I just didn't like the long downtime that was associated with hip replacement, so I kept avoiding it. Then I heard about the direct anterior approach from a doctor in Mansfield. So we did that, and I mean, it's not really, the old country saying, not much worse than a bee sting. And I actually went from the day of surgery until I was back in an airplane was 3.5 weeks.
With the standard total hip approach, whether it's from the side or for the back of the hip joint, we have to take down muscles and then repair them back. And usually that slows down the recovery, just because we have to give time for those muscles to heal back.
The anterior approach is unique in that we don't have to cut any muscle. We don't have to take any tendon away from the bone, and therefore we don't have to repair it, and we don't have to wait for that to heal before we can give you a green light and get back to your work and do what you want to do.
I think it was right about 3 weeks that he was back and cleared to fly.
The short term is, and especially with the anterior approach, if you need a hip replacement, we can get you back sooner. And long term, your function and quality of life are going to be much better.
It's been about 3 years now, and he came back to us. His other hip was giving him some problems, and his wife encouraged him, go ahead and take care of it while you're here. You know what you're getting into. You know it's just a few weeks off of work. Take care of it now. Don't postpone it.
So now I'm pretty limited in how far I can walk, what I can do.
We went skiing in January, and he really couldn't do anything because of the pain.
Today he came back for his second hip operation.
He had one a few years ago and had done exceedingly well. He was so ecstatic and did so well so quickly that he wanted to have his other side done.
Yeah, I want to get it done before it starts affecting my flying.
Let's get this pilot up in the air.
That's right.
It's being able to come in to a hospital like Methodist and have surgery, which takes an hour and a half, and then 2 or 3 hours after that to be able to stand up and walk down the hall again, and knowing that the pain that you came in with several hours ago is gone is truly miraculous in some cases.
I get to come up here the same day that they have surgery and watch them walk down the hall or walk with them, and they're telling me this is great. I don't need pain medicine.
Yeah, I don't have any hip pain at all, which is good.
Tonight he'll stay overnight, and I'll go home. And then tomorrow morning, I'll come back up and hopefully be able to go home lunchtime tomorrow.
Our average length of stay here for our anterior hip program is about 1.3 days last year, which is exceedingly well compared to the national average.
We don't send anybody anymore to a rehab facility.
You really don't need rehab. If you can walk in here, you're walking. Coming in here, you're leaving walking.
The rehab is totally minimized to sitting down and standing up. That's all I tell my patients to do. Just sit down and stand up.
Got a good team here, really good team. I mean, always concerned about the patient.
I mean, it's quick. It's back to normal very fast.
You know, there's not many surgeries that you can get up and say that immediately a few hours later, my pain is gone, and this is the best decision I ever made.